Okay, good morning Queensland, and from the outset can I sincerely thank people in southeast Queensland and in Townsville for doing the right thing as we embark on this 3-day lockdown. And today I can report some good news. So we have 4 new cases, 1 person from overseas hotel quarantine. There are 3 locally acquired and close contacts of existing cases. So we are considering these low risk. So this is very good news, but it does give our health officials the time that they need to do the contact tracing, which is wonderful news. So the first one is the brother of the Prince Charles case, that casual worker, and Dr. Young will give some details about that shortly. 1 is a close contact of the Portuguese restaurant cluster who was already in quarantine. And the third one is a close contact of the Virgin crew member and is also in quarantine. So that is also very good news. So we have 42 active cases. And can I say a big thank you to everyone. We've had 18,447 tests in the past 24 hours. So remember, please, if you have any symptoms, go and get tested. And I really want to thank the members of the Townsville community who came out yesterday and got tested as well, and that progressive testing of people on Magnetic Island is happening as we speak. So that's excellent news. I've spoken with the Mayor this morning as well, so it's wonderful to see people doing the right thing. So I thank everybody sincerely. We can get through this together if we all work together. Then also we've had 16,963 vaccines delivered yesterday. So I think this is another record. Yes, so that's fantastic as well. So people are going out and getting their vaccines. So our mission over the next 3 days is to do that contact tracing and make sure that we have everyone who is a close contact. So if you have been to any of those exposure sites, Dr. Young will run through some of those as well. Please make sure that you have a look at those. They are getting updated regularly, so you might miss some of them. So please go and check on that Queensland Health website as quickly as possible. Now, I just want to talk about a couple of things as well in relation to our small businesses. Look, I know that it's really tough for businesses at the moment. This 3 days is coming through the school holidays. Can I please urge people to support their local takeaway businesses, and hopefully we can get through these 3 days, fingers crossed, and things will be able to return to normal. But of course we'll monitor that over the next 24 to 48 hours. But I really want to thank businesses right across the southeast and Townsville for doing the right thing. Can I also do a shout out as well for masks? If you are out, you must have your mask on. We have some reports on the Gold Coast that people aren't wearing their masks. It's mandatory, so please make sure that you are doing that, unless of course you are just exercising by yourself. But please, if you're going out to do anything, to go grocery shopping, get supplies, make sure you put your mask on. So please ask everyone to do that. And finally, I just want to make a couple of other comments. So first of all, as I said yesterday about the overseas arrivals, maintain we need to reduce our caps of people coming in. It's people coming in from overseas or leaving Australia and coming back for a whole range of purposes. I have never said that vulnerable Australians should not be allowed to return home. I absolutely believe that vulnerable Australians, it should be going through the federal government, and we have a purpose-dedicated facility called Howard Springs that can deal with our vulnerable Australians. But there are a large number of people that are travelling overseas for business for a whole range of reasons, and there are questions that need to be answered about why they are not vaccinated leaving, and also if people are coming to Australia, why are they not getting their vaccinations? Because it is overseas arrivals that are bringing this Delta virus into our state. Now, secondly, I want to talk about vaccinations. We want Queenslanders to get vaccinated, but there is some clear guidelines that have been put in place by the Chief Health Officer, ATAGI, and the AMA. And there has been no National Cabinet decision about providing AstraZeneca to the under 40s. Let me say that again. There has been no National Cabinet decision about providing AstraZeneca to the under 40s. National Cabinet said that there was an indemnity for doctors. So that is very clear that National Cabinet did not make that decision. So I'd like to ask the Prime Minister, did his Cabinet make that decision? Now, in Queensland, we always follow the advice of the Chief Health Officer. So I urge Queenslanders to listen to Dr. Young and follow the advice of our Chief Health Officer. Also, we follow the medical advice, and the medical advice is very clear. Also, I draw people's attention to recent reports from the BBC over in the UK, where it says under 40s to be offered alternatives to AstraZeneca vaccine. It says here, most adults under the age of 40 will be given an alternative to the Oxford AstraZeneca vaccine due to a link with rare blood clots. So my message to Queenslanders today is please listen to Dr. Young and listen to the health experts when it comes to the vaccine. At the moment, the advice is for people aged 40 to 59 to get Pfizer and people 60 and over to get AstraZeneca. There has been no National Cabinet decision about AstraZeneca being given to under 40s. I'll hand over to Dr. Young.
Thank you, Premier. So 4 new cases overnight, and our contact tracers have been doing their work, and all of the people they've been working with, thank you very much, because all of these were known contacts. So we had 1 in hotel quarantine, a return traveller from the UK. So there's that case, our usual case in hotel quarantine of an overseas return traveller. Then 3 community cases. 1 is the brother of that case, the receptionist at the Prince Charles Hospital. So they became infectious on the 26th of June. They were up in Magnetic Island. They then returned down to Brisbane, and they did attend a school holiday tennis camp, the Shore Park Tennis Centre at Wooloowin, on the 28th of June. So we'll be contact tracing there. But we'll just work through what those risks are from that particular individual. Then we also have a co-flight crew member of that Virgin crew member who was on those 5 flights while infectious. So they were in quarantine, and we're just working through whether they were out and about before they went in quarantine during their infectious period. So we'll be looking at that. And then we had another case related to that Portuguese restaurant cluster, and they were, because they were a close contact, they were in hotel quarantine during their entirety of their infectious period. So that's not a concern. So we now have those 42 active cases, which does concern me because a lot of these active cases are the Delta variant, and we know that is very contagious. So yes, we are doing our best to manage that within our hotels, but they're not designed for that process, and we're also doing our best to manage them in our hospitals, but it is a very, very contagious variant. Thank you to every single person who's come forward over the last 24 hours to get tested. We did 18,447 tests on 18,183 people, which is a magnificent response, particularly those people up in Townsville. You really came out and got tested. Thank you very much. Now, I have some good news about Townsville. I was concerned about that ferry terminal because of the linkages between Palm Island and Magnetic Island. You need to go through that same ferry terminal. But the family from Brisbane who went up to Magnetic Island went in a car, and they were in a car when they went across to Magnetic Island. They didn't go out and about into that terminal, which significantly reduces the risk for those people from Palm Island. Doesn't remove it, because we know that the people from Palm Island frequently come into Townsville, and they may have gone to one of the venues in Townsville, such as that those markets on that Sunday morning. So it doesn't lift the need for the restrictions. It's really important that all those people in Townsville City, Magnetic Island and Palm Island remain in their homes or residences for that 3-day period, except for the 4 reasons you can leave. But it has, I thought it might be reassuring for those people in Palm Island, because I know they were quite concerned about the terminal. So we've done a record day in terms of vaccinating, and we are going to be using every dose of Pfizer vaccine that we get from the Commonwealth. Of course we are. So please, if you're in those groups, particularly if you're aged care or disability care worker or a healthcare worker, you are an absolute priority. You must come forward and get vaccinated. That is really, really important. You are a priority. Then anyone aged 40 through to 59, if they can get a booking, we really want people to focus on bookings rather than walk-ins, because if you walk in, there's a good chance you won't be able to get vaccinated, because we will always do those people who've booked first. So 40 to 59-year-olds, go online and find a booking. And all of course, are 1A, 1B, so that you get vaccinated in one of the Queensland Health Pfizer clinics. Now, the Commonwealth has said they will start distributing, when they get some more vaccine, Pfizer to GPs, so you'll be able to go to some GPs who get allocated that Pfizer vaccine. Now, anyone who is aged 60 years or older, please, if you haven't already, immediately make a booking. There is plenty of AstraZeneca vaccine available. Make a booking to go to your own GP. If your GP is providing vaccine, go to one of the pharmacies, and there are more pharmacies being stood up, or go to one of the Commonwealth vaccine centres and get vaccine there. Some of our hospital and health services will also have AstraZeneca vaccine. Now, if you have already had 1 dose of a vaccine, it is vital you get a second dose of the same vaccine. It doesn't matter what your age is, you need to get a second dose of the same one. Thank you.
So thank you to all the Queenslanders who came out and got tested, and also record numbers of vaccinations, which is fantastic. I do want to talk about vaccinations. We are calling on people to get vaccinated. However, we are running out of stock on Pfizer. So the Director General of Health wrote to the Lieutenant General John Fuhren yesterday and asked if we could get an extra 152,100 doses, so an extra 130 trays. The reason we gave is that we are at critical levels, and that at some of our sites we are projected to run out of Pfizer by as soon as week 20. That's the 5th of July, next Monday. At some of our sites we are due to run out, and one of those sites being Sunshine Coast University Hospital. Our reason also is, we said additional vaccine supply is critical to avoiding cancellations of already committed appointments, and to ensure that we can continue to prioritise areas of high risk. Now, we sent that letter yesterday. We got a response this morning from the Lieutenant General. We have been advised that we will not be provided additional vaccines of Pfizer. Now, about 3 weeks ago, when Victoria went into lockdown and asked for additional supply, they got an extra 100,000 vaccines. We weren't offered less than what we asked for. We have been denied any extra vaccines. We are only getting about 64,500 a week in July, each week. We got 45,000 vaccines delivered yesterday. And on that delivery and our calculations, we have about 8 days stock. 8 days stock left for Pfizer. So we are getting to that point that we will have to start prioritising only second doses if the Commonwealth do not have any vaccine left. And they need to tell us, is what they gave Victoria at the end of it, have we only got what is allocated and no contingency stock left until that big delivery in October? Because we all need to know. Now, maybe this is why the Prime Minister's come out and suggested that under 40s get AZ. But we have to act on the TGA and ATAGI's advice in relation to that. It can't simply be because we have a lot of stock of one vaccine and not enough of the other to start recommending that people get a particular vaccine. That advice should always be based on clinical advice. So I am disappointed that we have been denied any extra vaccines, despite the reasons we've been given, despite the fact that we are going to start running out of vaccines. And I would welcome the Commonwealth telling us exactly how much vaccines they currently have on stock. Thank you.
DP?
The Chief Health Officer has advised us this morning that genomic sequencing on the receptionist from the Prince Charles Hospital has confirmed that it can be traced, that cluster can be traced back to a returning traveller being treated at the Prince Charles Hospital. They had been allowed to come and go between Australia and Indonesia repeatedly throughout this pandemic by the Morrison government. They are not vaccinated and have been through our hotel quarantine several times. Yesterday, 223 international travellers arrived here in Queensland. We have never said that vulnerable Australians should not be repatriated home through hotel quarantine. In fact, they should be. But the ABS data, the federal government's own data, confirms that thousands of people are being allowed to travel here who are not stranded Aussies. These are not Australian citizens or permanent residents, but every week 600 UK citizens arrive in Australia, 500 Chinese citizens, more than 300 Indonesians, more than 250 people from the United States, more than 200 people from the Philippines, 115 people from South Africa. In fact, last month, 20,000 non-Australians arrived in Australia, permitted by the Morrison government, half of those on short-term temporary visas, 3,330 on temporary visitor visas, 4,650 on other temporary visas. We have no idea how many of those people are vaccinated. We do know that many of those people will have COVID-19. The borders are not genuinely closed, and these travellers are displacing Australians who are genuinely stranded overseas, genuinely trying to get home. This is the federal government's own data, and I note that they have directed the Australian Bureau of Statistics to stop now reporting this data. So from next month onwards, we will not know how many people they are allowing in breach of our closed borders. In addition to the non-Australians returning, every month about 40,000 Australian citizens and about 6,000 permanent visa holders are allowed to leave the country. Many then seek to return, rejoining the queue, going back through hotel quarantine, putting our community at risk. It turns out the only thing that's required to get a permit from the federal government to leave the country is proof that you have a meeting in another country, proof that you have a business meeting. It's not good enough that just because you can afford a business class flight or a charter flight, you can breach our closed international borders. It's not good enough that the borders are open for the Prime Minister's corporate mates, but closed for the rest of us, putting Queenslanders at risk. We need to reduce the number of people travelling overseas and back into the country, the number of people coming into the country with COVID, until we have higher vaccination rates and dedicated quarantine facilities. Now, you've heard from the Health Minister how Queensland Health is just days away from running out of Pfizer vaccine supply. And if that were to happen, we would need to slow our successful vaccine rollout. We requested more Pfizer vaccines from the Commonwealth as they provided to Victoria, but that request has been declined. We will only, the Queensland government will only provide to people the vaccine that is medically recommended for them. We will not ignore the health advice. For the Prime Minister to attempt to overrule the medical advice and provide a vaccine that is not recommended for people under 60 puts Queenslanders at risk. There is some discussion that the Commonwealth might even provide their own vaccination hubs so that they can get AstraZeneca vaccine out to younger people despite that vaccine not being recommended, and that would be very risky. I note that the Australian Medical Association has come out and said that people shouldn't follow the Prime Minister's advice, that they should follow the otherwise consensus health advice. I'm concerned about reports that GPs were inundated yesterday with requests from younger people asking to get a vaccine that is not recommended for them and that their general practitioners are unlikely to provide to them. So I would say to Queenslanders, throughout this pandemic, the advice of our Chief Health Officer has served Queenslanders incredibly well, and they should take her advice about which vaccine is medically appropriate, not the advice of Scott Morrison.
Thank you, Premier. Could I just start with saying that thank you to the community. So the initial part of our lockdown in the southeast corner and also in council is going very well. So the overall levels of compliance have been good. At our road borders yesterday, we intercepted 1,759 vehicles and only had to turn around 3, so that's very encouraging. And also at our airports, 2,098 passengers processed, domestic that is, only 3 turned around, 57 into quarantine. Until 6 a.m. this morning, we'd intercepted 28 people that were not wearing masks, who after discussions with police and being provided with a mask have complied with that and are wearing them. One person, however, yesterday in Nambour, a 36-year-old male, refused on several occasions to wear a mask at the Nambour Library and was issued with a $200 penalty infringement notice. So the message to the community is, of course, we will work with you. Please comply with these restrictions. I will give you every opportunity to do that. However, there are consequences if you don't do that. Thank you. That's it, sir.
Sorry. I can't remember. Are you surprised that, given the potential for the spread of Delta from this woman where she's been there, effectively only have one case?
Look, it's early days, so we've got the next couple of days where we're in lockdown, so we can do the contact tracing, which is very, very important. But fingers crossed, today is looking very good.
When do you expect to make the call on whether it's a lift or lockdown?
Well, that will be made on Friday when we get the data through, like we do every day.
Premier, why wasn't the receptionist vaccinated, given she worked on a COVID board?
Yeah, well, there was a direction in place, and that direction wasn't followed. It wasn't a guideline, it wasn't a principle, it was a direction. So there'll be a full investigation into that. But as you heard the Deputy Premier say, the person who brought the virus in to Queensland was a regular traveller, not a vulnerable Australian returning home, a regular traveller who was unvaccinated. And I honestly think we need a serious discussion about ensuring that people are vaccinated coming into this country. We have got to minimise the risk. We're at a pressure cooker moment at the moment. So right across Australia, it's like a pressure cooker. We've got to relieve that pressure. So what are the levers we can pull to relieve that pressure? Well, we can lower the caps, lower the people coming in, make sure the people coming in are vaccinated, make sure they're tested, and to stop the lockdowns on the East Coast, have regional quarantine facilities. Have them away from your densely populated areas of the capital cities, which then forces them into lockdown. These are very simple levers that can be pulled, but it needs everybody to work together. Now, I'm just going to say this. The facility up in Toowoomba could have been built by now. Could have been built, and it's not. You know, we've got to go through this rigmarole about now looking at alternative sites. We need both. We need both to stop the hotel quarantine. But also too, Australians leaving here need to be vaccinated.
How long had the woman been in the job and how was she able to get
I don't have those details. That'll be part of the full investigation. Sorry, Jack?
Have efforts been made now to ensure that every worker in these COVID wards is actually vaccinated? Can you guarantee that every worker is vaccinated?
Well, what I can say very clearly, and Dr Young might want to address this as well, that Dr Young actually called a meeting yesterday of all of the HHSs to ensure that that is happening.
Premier, that aside about your quarantine hubs that you want built in Toowoomba, as you said, this was the law. The health officials, her bosses have failed here. She's failed to follow that directive. Is someone going to get the sack here?
Someone will be held responsible, yes.
Someone will be fined.
Someone will be held
I
responsible.
mean, because there are a lot of people out here who are now in lockdown. Half
Yep,
the state is.
absolutely.
And it's basically, because of
and,
this, they are in lockdown.
and if the person who had been a regular traveller to and from, this is what I'm hearing, was a regular traveller to and from Brisbane, had been vaccinated, they wouldn't have brought the Delta strain here in the first place.
You said in March you were furious.
Unvaccinated health workers are travelling to remote Aboriginal communities?
Sorry?
How many unvaccinated?
I don't have that data.
Why is that not mandated that people travelling to these vulnerable communities are vaccinated?
Well, we're even now looking at getting the FIFO workers vaccinated. They are regular travellers as well, and they haven't been vaccinated. So we're working with the Resources Council now, and they've been really supportive, and the unions. So this is industry and unions working together to say, let's get these regular workforces vaccinated.
Is there anyone keeping
But you can't vaccinate unless you've got the supply. So we know that there is, if you can just wait for one moment, we know that at the end of this year, the last quarter, there is a lot of supply coming. So there'll be the supply of Pfizer and the supply of Moderna. But I do not think this is the time to risk the safety of our young Australians when the UK will not even allow their under 40s to get the AstraZeneca vaccine.
Premier, back in March, you said that you expected frontline health staff.
I can only answer one question at a time. Shannon.
Thank you. You said back in March that you expect our frontline health staff to get that vaccine first dose completed by tomorrow. That was in March. Then in
Yes.
2 months ago, you said you were furious that frontline health staff still weren't vaccinated. Then on 31,
Yes.
May 31, that declaration was made that all
Yes, May 31,
staff
yes.
in close contact with COVID patients, all of the staff working with them should be vaccinated.
Correct, and she's a
still not vaccinated.
casual clerk, and Dr. Young, Dr. Young's pretty annoyed about this as well. So Dr. Young called an immediate meeting yesterday of the HHS chairs to ensure that this is done. I might get Dr. Young to address that in a bit more detail.
Just before that,
Okay.
you said that though, that you expected all frontline staff to be vaccinated by tomorrow back in March, and only 66% have. Some heads have got to roll here. I mean, how does it take that long to find out?
There will be a full and thorough investigation, and someone will be held responsible. I've said that clearly.
Why is nobody keeping track of who is and is not being vaccinated?
Sorry?
Some of these people, these 30% that aren't listed, might have been vaccinated by their GP. Why is nobody keeping track of who has and has not been vaccinated in our hospitals?
Yeah, and I think that's probably the situation right across the nation. So that's a very good question.
Premier, you've got the health minister standing right next
Yep.
to you. Do you find that she's responsible for the health department?
The health minister is doing an excellent job during this COVID pandemic, and she is just as annoyed as everybody else. And as she has said, there will be a full investigation.
So you won't hold her responsible for this?
She does not go and do the vaccinations of these people. Okay? All right. I'm going to hand over to Dr. Young now. Thank you.
Thank you, Premier. So the first priority group was 1A, and that included quarantine workers, workers at the international border, and workers in our COVID wards. So they were all done. There was a process put in place. The issue here is that this individual worked outside the COVID ward. She did not work in the ward. I believe that is semantics, but that is what the investigation will look at, whether or not they thought that she was part of the COVID ward and needed to be vaccinated. I have made it crystal, of course I think she should have been vaccinated. I've made it crystal clear that this is why I wanted one COVID facility in the state, but we couldn't do that. The hospitals told me they could not allocate one hospital to purely be responsible for COVID cases. So we then developed our network model, which I've spoken to you about before, involving 5 hospitals across the state. And I went and visited all 5 of them to look at the systems they had in place and made it very, very clear that these people needed to be isolated from the rest of the hospital. And that is what the Prince Charles Hospital did. They did a very good process in terms of finding part of their facility that is very separate from the rest of the facility, so there is no risk to the rest of the hospital, because I wanted to stop that process of having to close down hospitals. Remember when the PA had their outbreak and we had to stop treating people there, we had to stop doing elective surgery, outpatients, emergency departments. So the Prince Charles did a very good job finding an ideal place to manage these. They just didn't think that the corridor outside their COVID area that was totally removed from the rest of the hospital was a risk. And clearly it is a risk. We know that. But we also have to remember it wouldn't have been a risk for Alpha or for those previous variants. It's the Delta variant. We know that the Delta variant is virtually impossible to control. So we're going to have to yet again, I'm sure you can remember that each time we got a new variant, I increased the mitigating factors. And I'm going to have to do that again. So I'm going to have to look very carefully what is the next step to make our hotels and our hospitals even safer than what they were. I'm running out of ideas here about what we can do. Now, this is not normal for a pandemic. Most viruses in a pandemic don't become worse, they become better, if I can put it as simply as that. So this is breaching every rule book. We've known about this right from day one. This is a very different pandemic to the pandemic we've used. Sorry?
How upset are you that only 60% of the health workforce is home?
Right, remember that most of our health workforce is working in facilities that don't take COVID cases. I've made it very, very clear that if someone has a COVID case, they have to be moved to one of those 5 network hospitals. So they shouldn't be treating them. So I went and said the priority, the absolute priority is those 5 networked hospitals, because I knew we were going to struggle to get every single person vaccinated. Yes, I would like to see, of course, 100% of our hospital and our healthcare workers, administrative, operational, cleaners, maintenance men, 100% of them vaccinated. And that is what is happening now. It's a concern that it's taken this long, but I can understand that, because there are some other groups that are actually more important. So if you work out at Weipa Hospital, you don't have any COVID cases or any international border, then I actually think it's more important that we get the international flight crew coming into Brisbane Airport vaccinated, and all of the workers there and the workers involved with cases ahead of them. So this is that really fine balancing act. And unfortunately, we don't have enough Pfizer vaccine to just say, right, let's vaccinate everyone, which of course is what I would want preferentially. Sorry?
Why is it not mandated for health workers going into remote Aboriginal communities to be vaccinated?
Yep, so again, we're working with all of those. But remember, it depends where they're coming from as to what the risk is. So all of that is happening. So I do want every single healthcare worker, around 110,000 employed in Queensland Health, to be vaccinated. But there are also other people who go into those remote communities, and I want them vaccinated. So the RFDS goes in, for instance. So we've got to just make sure that we don't fix one issue and leave another issue. We've got to go right across the board.
Dr. Allen, there were other who tested positive. Is there any concern with the school that he attended?
Yes, he did attend the school for a Monday holiday camp. It wasn't at the school, it was at another facility, so we're doing all the contact tracing there.
Cut to the chase. Do you think under 40s should get AstraZeneca?
No. I'm
Why?
sorry if I haven't made that
Why?
clear.
Well,
No, I do not want under 40s to get AstraZeneca.
Why?
Because they are at increased risk of getting the rare, it is rare, but they're at increased risk of getting that rare clotting syndrome. We've seen up to 49 deaths in the UK from that syndrome. I don't want an 18-year-old in Queensland dying from a clotting illness who, if they got COVID, probably wouldn't die. we've had very few deaths due to COVID-19 in Australia in people under the age of 50.
What?
And wouldn't it be terrible that our first 18-year-old in Queensland who dies related to this pandemic died because of the vaccine?
What did you think of the Prime Minister's announcement that it was, they should get?
Well, I haven't been able to talk to him and to understand his thought processes. The Premier announced in National Cabinet that there wasn't a discussion, so I genuinely don't understand his processes. I know an urgent meeting has been called by the Commonwealth today with Chief Health Officers to talk this through, so I'm sure I'll find out more information.
Is your view consistent among all of the other state Chief Health Officers?
Yes, so we're all following the ATAGI advice. So ATAGI initially came out on preliminary data that people under the age of 50 should preferentially be given the Pfizer vaccine. And then once we started getting Australian data, because sometimes it is a bit hard to get data from overseas and untangle it and understand it, ATAGI then came out with amended advice and made that age 60.
If I was lucky enough to be 40 right now, I would be confused because you're saying don't get the Astra. The health minister is saying we don't have Pfizer. What do they do?
At this point in time, they wait until the Pfizer is available. So we've got 42 active cases in Queensland today. You look across the country, active case numbers are in the hundreds. We are not as Indonesia is. I mean, if I was the Chief Health Officer in Indonesia, I might be giving different advice. But I'm here in Queensland and I need this lockdown for the next 3 days so that we can contact trace everyone, get everyone into quarantine so that when we open up again, that the people who are most likely to be spreading the virus are safely in their homes in quarantine. That's what I need to do to then manage our outbreaks. I don't need to go and ask young, fit, healthy people, because if you weren't young, fit, healthy, you're able to get Pfizer. Remember that? You can get vaccinated if you've got underlying severe disease. So we are not in a position that I need to ask young, fit, healthy people to put their health on the line getting a vaccine that could potentially significantly harm them.
But Minister, you said you'd ask for an extra 152,000 Pfizers, but we're only going to get 64,000.
The 64 is our normal supply. That is planned out over the next week. We wanted 152,000 on top of our normal supply, and we have been told we're not getting any extra.
Mr. how many of your frontline staff have been vaccinated?
So, as a minimum, so those who have come to state vaccination centres, it's almost 60% have had their first dose. 50% of our total health workforce in the state system has already had their second dose, but there'll also be others who have gone to GPs and to Commonwealth vaccination centres. Now, I just want to put this into context. 50% of all of our health workers have been fully vaccinated by the state government and by the state health system, compared to aged care workforce, which is 16%, and nationally, the population is 4%. 4% of Australians have been vaccinated, 50% of our health workforce has been vaccinated. So, but all those, can I be clear also, our 1A group was vaccinated. In this case, there is a dispute as to this person whether they are 1A or not. My hospital and health services have assured me, and through audits we have done previously, our 1A group was vaccinated. But in this case, there seems to be a view that this person didn't fall into 1A, so they weren't mandated. Now, there isn't a...
Given we're in a lockdown and you've delivered a pathway for the virus outside of the COVID ward, do you owe Queenslanders an apology?
Well, we have to remember that we have been trying to contain an invisible, highly infectious virus for 18 months now. There is no country in the world that has been able to ensure that there has been no transmission in their community. Not one. What I can say is Australia and Queensland has been one of the best in the world. There has been over 3.8 million deaths now globally. There are still thousands of people dying every single day around the world. We have maintained and managed to get only 7 deaths. Tragically, 7 deaths have occurred, but 7 deaths in Queensland. So I'm proud of what we have done. Of course we want all of our health workforce to come out and get vaccinated. But nationally, National Cabinet has not mandated vaccinations for health workers in this country. The only mandatory vaccination has occurred in the last 2 days for aged care workers.
So you don't see any failures here?
We are doing our absolute best to not transmit in the community. Now, New South Wales has their cluster because a driver wasn't vaccinated.
But they're not angry at you, they're angry at somebody else.
I think that the public understand this is a highly infectious disease that we are doing everything possible to contain. Hotel quarantine, hotels were never built to contain this. Even some of our most expert specialists in infectious control in Queensland have said to me when they've managed Ebola in other countries, no matter how much you try to control this, you can have the entire outfit from head to toe on, these viruses find a way. We are doing our absolute best and our health workforce are doing their absolute best.
Isn't it a simple procedure to keep track of who has and has not been vaccinated?
We've been asking this from day one. We can control the data for the people who come into the state vaccination centres. But those who choose to go to those that the Commonwealth manage through GPs and Commonwealth vaccination centres, we don't have that data. We've said from day one the Commonwealth should have a data system that we can track and manage and know who's getting vaccinated.
But
we do not have access to that.
The Chosen Directive on May 31 says anyone who's working in close contact, that directive says anyone working in close contact or on a COVID ward must notify their boss that they've been vaccinated, regardless of whether it's done by a GP or one of your state health clinics. Where's that data?
Well, what we have said, what the direction says, is anyone working in and around COVID wards must be vaccinated. Now, there is a dispute over whether this person falls within that definition. I'm going to fix that definition because I'll widen it. So if there's not going to be a grey area, because every hospital and health service in Queensland will know who is in the 1A group and they will have to be vaccinated. Okay. And if they don't, then there will be consequences to that. This person should have been vaccinated. I cannot be clearer. The Chief Health Officer said that.
Has your health department failed?
I believe that someone has failed here, yes. And there will be an investigation because this person shouldn't have been working where they were without vaccination.
Are you locking down Prince Charles?
I'll get the Chief Health Officer to talk about that. But as the Chief Health Officer said yesterday, this individual had only had contact with about 3 other people. So 2 other clerical staff. Yes, but where she works is a separate area, not in the main part of the hospital, where she only had contact in her shifts with 2 other clerical staff and the janitor. That is the advice we got yesterday. Of course, those people have been contacted and put into quarantine. So we're very fortunate that in the hospital environment, this individual's had very little contact with health workers, but of course we've got the other contacts as well.
Just quickly.
Thank you.
Is your Christian Tokyo considered a business trip?